Hey, welcome. I'd like to talk to you today about some of the work that I've done in the past and also teach you how to replicate. Pardon me, I'm having trouble getting my camera to settle down, but this is kind of the reality of being your own cameraman. Let me get this into a better place, okay? All right, thank you. Essentially, um, I was brought on board to a New England pain clinic, and my job was multiple. I was to assist anesthesiologists in their practice and helping people with acute and chronic pain problems. I was also a licensed alcohol and drug counselor, so I was keeping an eye on people who were shopping for opiates. But most importantly, I was providing behavioral medicine treatment for people who had various physical and pain maladies. And what is behavioral medicine? Behavioral medicine is, just in a nutshell, it's utilizing psychological, um, even hypnotic principles to teach people mind over pain, or MOP. We'll talk about that. I'll use that interchangeably today. MOP strategy. So I also call it MOM, mind over matter. MOP. Okay. So today, what I want to talk to you about is what I call how to have an OBE without an NDE. And for those of you who know, OBE stands for an out-of-body experience. It's actually been paired with people who have near-death experiences, and they leave their body and they hover above while they're either going to make a decision to come back. I've actually had one myself. I was brought back using CPR. I was actually flatline dead from a diabetic complication. It's not a scary thing. In fact, I just had made a decision to come back and stick around and see my daughter graduate, get her nursing degree, and I want to hold my first grandchild. There's just reasons I decided not to go. Okay? But I'm talking about having an OBE, out of body experience, without having a near death experience, like I was just discussing. You can, in fact, leave the body. You can learn to separate from your body. It's actually sometimes seen as a negative for people who have what are called dissociative disorders, where they because of certain traumas, have to leave the body. Oftentimes, not to be blunt, but people who are raped, they're not there when that is occurring. They leave the body for good reason. At some point in one of these trainings, I talked to you about Jack Schwartz, who was tortured by the Nazis. And there are some things that are much worse than death. And so after about 20 days of daily intense torture, he did in fact learn to leave the body. But then he did some other amazing things. But we're not going to talk about doing amazing things per se. I want to teach you a strategy. But I want to tell you how one particular patient I work with was so good at this that she amazed me. I walked her through the steps, teaching her how to have an out-of-body experience. And in so doing, she was in fairly excruciating pain despite being on heavy-duty narcotics. And essentially, once I taught her how to do this, she decided to kind of show off, and she was able to walk from one end of the room and bring a pain level of 9 down to a pain level 0 by just simply walking across the room. I'm just giving you that as sort of a teaser. I want to begin to give you some background so that some of my training is in physiology, human anatomy. I have a Master of Science in clinical psychology. So a lot of my work has been very science-based. I have a Bachelor of Science in psychology. I was also a doctoral student before I became visually impaired. And so that science comes in handy but I've also learned that helping people is both a science and an art. Okay, so let's just give this some initial thought. You have two bodies. You have a real body, that is this flesh and bone one you can touch, you can feel, and you have what I've phrased a kinesthetic body. Kinesiology, kinetics, it's all based on that same concept of movement, the kinesiology or the kinetic body. So the kinetic body is actually a body that you have sort of wired in your brain. Let me give you an example. Obviously, we don't have to go into depth and detail about the real body. It's the flesh and bone one. It's the one that's experiencing pain. It's the one that experiences sensation. But the kinetic body, or what has been called at times in spiritual practice, the ethereal body, is actually based on movement patterns and pathways. For example, let's say I'm going to go over, there's a cup over here, I'm going to go over and I'm going to reach and grab that cup. Believe it or not, I've reached and grabbed cups, I've reached and grabbed many things, and when I was a baby, I was reaching and grabbing just to build that network in my mind, just to build that, I think it's in the cerebellum part of the mind where movement and those sort of dynamics are mapped. I know enough, even though I'm visually impaired, I can still go through a general pattern and pathway to go get that cup. Okay? So the real hand reached to get that cup. But before I did, I actually have almost, not, I don't know if it's called a premonition or a pre-patterned movement that's about to happen. And I know that. Example, before I reached, I can actually know that the pathway my hands is going to take. And what I'm trying to teach you now is the real body, this hand, is actually preempted by the kinesthetic body, which is the pathway of the hand. I don't want to overcomplicate this, because once I demonstrate and I show you how to do this, this is the doorway to leaving pain behind. And again, I want to make a quick caveat for you that we're not talking about functional pain. Functional pain is pain that requires medical attention. It requires that you go to the ER. It requires that somebody put a splint on something, or they stitch you, or whatever. We're not going to walk away from that. And they're never going to, as I mentioned before, the functional pain phone line is red. It's a hotline, and we're never going to disconnect it, and we're never going to turn it down, because pain is a message from the body that something's awry, and you don't want to ignore a symptom that your body's trying to warn you about. Let's say you have abdominal pain, and it's more than just a stomach ache, and it goes on for a couple days. Well, that's a sign that something's wrong, and you may need to go to the ER or go to your local doctor and let them diagnose what's going on. Okay? So that's functional pain. What I'm talking to you about here is non-functional pain. And if you choose, believe it or not, there are people who have dental, I had a molar extracted without anesthesia. Yes, it's well known. You can use it for dental anesthesia. You can use it to help in a surgery process, but I wouldn't recommend that you don't use medical science unless you're really getting really brave and you've been practicing for many, many years. Okay? So that's the caveat. This is about non-functional pain, what's called chronic pain syndromes, arthritis, rheumatoid arthritis, pain, joint pain, bursitis. These kind of things are leftovers, nerve damage from injuries, issues that are related to a back surgery, those kind of things, okay? Non-functional pain messages. And they can, in fact, drain you. They can take away your life, your freedom, your mobility, and they eat up energies. If you're suffering from that, I think that you could speak to that truth, that chronic pain is a drain. Okay? So what I want you to do for this demonstration is I want you to take your non-dominant hand and arm, and I want you to extend it out. Just extend it out in front of you here. Okay? I simply want you to now to just sort of have an awareness of your arm in space, that it's probably weighs about 3 pounds, maybe 4 pounds. And there's your arm from your shoulder all the way down. And just have an awareness of your real arm. I originally called this the RK, or the Real Kinesthetic Pain Management Strategy. RK. Okay? Real Kinesthetic. So now, as you have that awareness, it's really about focusing your mind on that particular part of your body. And if you notice this, as you're focusing your awareness on your arm, the rest of your awareness of your body moves to a subconscious level, doesn't it? You still know you have the rest of your body. You still know that it's there, but it moves into the background. In the foreground is your awareness of that arm, your hand, your fingers. You know, if you get to the point where you start having sort of a subconscious interaction with the arm, what you'll notice is the fingers may start to tingle. And I mentioned that oftentimes in the alpha brainwave treatment that I'm showing and I'm treating and helping with. Okay? So now that you have that awareness, I'm going to count from 1 to 3, and when I reach 3, I simply want you to raise that arm up, and as you raise it up, I want you to be aware that technically there are an infinite number of kinesthetic arms on the way to whatever position you raise it up to. Doesn't matter. You could be like raising your hand in class. But I want you to notice subconsciously, because you keep a kinesthetic pattern. You know these movement pathways. And I want you to just make note of that. And what I'm trying to help you to be aware of is something that you've been automatically unaware of. You've been moving around since you were a child, since you were a baby, and you moved kind of gangly at first, and then you got more and more fine in your motor movements, and then you were running and you were sprinting, and sometimes you were dancing, but at one point you were just simply laying on a baby blanket, and you were doing none of that. But in between that, you were building these kinesthetic patterns. And I just want you to take that awareness of these kinesthetic patterns and use it to manage pain. And later you'll remember I told you about that patient. We'll call her Jean. It's not her real name. And how she was able to walk across the room, and just by simply walking took her pain levels of 9 down to 1. It was probably a 12-foot wide room, 12 by 12, something like that. It's my clinical office. Okay? Let's do that. And I simply want you to make note of this. We're not going to do anything yet with it, but I want you to notice your real and your multiple kinesthetic arms. 1, 2, 3. Raising it up. Remember where the arm was. Notice where the real arm is, and notice how many. Technically, there's an infinite number of arms. You could keep putting another slice of an arm in between all those arms, so on and so on and so on and so on and so on. Okay? So now you have sort of let your brain be aware of something you've been you learned these patterns so early that you've been unaware of. You've been moving without thinking I'm moving, okay? And I'm now just having you become aware of movement. Real kinesthetic. All right? Now you have those two realities, don't you? And we can exploit what the brain's doing with those two realities. We can exploit it for you to be able to manage your pain. And what I really do know is essentially however you decide to take this basic building block of pain management and be as creative and as innovative as you choose to be. I'm not going to limit you in how you interpret this information, okay? Because the goal here is for you to use inner parts of your mind, subconscious, the part of you that's controlling the 30 trillion cells in your body right now, the part of you that's orchestrating all the organic functioning of your vital organs, corpuscles, muscles, your brain functioning, the neurons, etc. That we can tap into that intelligence to help you to drain your pain, to help you to let it go, okay? Now, once you learn how to do this with your arm, there may be parts of your body that you want to learn to apply this to, and it's called the generalization function of the mind, of the brain. Once you learn what you can do with the arm, well, you can do the same with your spine, with your back, with your teeth, with your, with migraines, etc. You can move your head and leave the headache over there. That would just be an example. Okay? Again, I'm not offering you medical treatment. If you need genuine medical treatment, please get it. Okay? So what we're going to do now is I'm going to say, all right, let's say you have like tons of aching pain in the real arm. If you don't, that's fine. But we're gonna feign the pain. We're gonna feign it, okay? And so I want you to think, oh, it's burning. It's just I can feel it. All right. And I'm gonna count from 1 to 3. And what I want you to do is, as the real arm moves up, let the pain flow into all the kinesthetic ones, including where the real arm was. All right? And let your brain continue to work with this, because once you practice this over and over and over, it can be an amazing relief. And it was helpful for, I'm guessing, a couple thousand people who really got the hang of this, and it helped them. And helped a high majority of those people who come off opiates, narcotic pain meds, which can be nasty. All right? So here we go. The arm, it's feeling stiff, rigid, there's pain in it. I can feel it. All right? And at the count of 3, we're going to raise the arm up, and I'm going to let you just go ahead, almost like seeing it drip down into the kinesthetic arm. Ready? 1, 2, 3. Just feel the relief. Whoa, feel it floating. It's like, like balloons are pulling it up, and you can let that sort of sit in space up there. And just let this, the kinesthetic arm can handle infinite amounts. You could just let it drip into there. And notice, if you just listen to the way your mind works, how much better that arm can begin to feel. That the real arm is feeling real relief. Real relief. Okay? Real relief. And the mind can continue, the brain can continue in its allowing the pain to drain into the K arm, the kinesthetic arm. Okay? That's really, you can let it come back down. You can push all that over there, let it wash away. Your imagination is very powerful in the management of chronic pain. If I said to you, let's move that nasty kinesthetic arm over there and just let it be washed down a river, of course you can imagine that, you can envision that, and there we go. This is the primer that I want you to do over the course of the next few days, is just simply do that 1, 2, 3 process. Reminding yourself of the real arm, reminding yourself that it's not only a kinesthetic arm, it's at least 1,000,000 in between where you started the arm position and when it was up, almost floating with balloons holding it up, okay? Technically, mathematically, there's an infinite number of kinesthetic arms. And if there's an infinite number, wow, do you have a cool place to drain the pain into all those various arms, okay? So I wish you well, and this is what Jean was able to do. She was able to stand in a position, become aware of her real body, and then I had her simply first take one step. Doesn't matter, to the left, to the right, forward, backwards. Take a step, and as you do that, become aware. At that moment, your awareness can hold the fact there's a real and a kinesthetic body. Your real one, where you were, is now become the kinesthetic body, and what was the kinesthetic body becomes the real one. And once she had that awareness, I saw an aha in her eyes. I saw her just really put this all together. But it wasn't the first time she knew this. She knew this when she was an infant. And we're going to take that early learning and knowledge and use it to help you. And yes, I remember Jean telling me she was walking down the street, walking with her grandchild, and all of a sudden all the pain had gone away. All of it. And she literally could carry her grandchild to the preschool, and she couldn't believe it. And it can free up energies for you. That's all I can say. That there's a lot of energy needed to deal with chronic pain. And when you can step outside of it, you begin to break the pain cycle. Thank you very much. This is Rob Hoyt, the Chi Mind Master, saying to you, there are more than two bodies. And go ahead. You can drain your pain. Thanks a lot. Good luck. I hope this brings you lots and lots of relief.